Hello, I am Dr. Lawrence Smith, Dean of the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Thank you for tuning in to Well Said. In a culture of community, scholarship, and innovation, the Zucker School of Medicine is dedicated to transforming students into doctors who will improve healthcare, inspire change, and better the lives of the people they serve. It is why we are pleased to collaborate with WRHU Radio Hofstra University to bring you a program committed to sharing expert discussion and insight on health and wellness topics important to you. Join us today and each week for a recommended dose of Well Said with your host, Dr. Ira Nash.
Hello, I'm Dr. Ira Nash. Welcome to Well Said. Today we'll be discussing antibiotic use and resistance, which is a growing cause of concern. Antibiotics are a class of drugs used to prevent and treat infections. Increasingly, they're not up to the task as the microbes they target have become less susceptible to their action. This has huge implications. To shed some light on this topic, my guest this week is my colleague, Donna Armellino. Donna is an RN with a doctorate in nursing practice and is the Vice President of Infection Prevention for Northwell Health. Donna, welcome to Well Said.
I appreciate being part of this discussion.
So I know you've been playing an important role in how Northwell has been responding to the COVID pandemic and have been one of the busiest people I know over the last year or so. How have you been holding up personally?
It's been an interesting year. We've all expected and anticipated a pandemic to present itself at some point in time. Early on in 2020, it definitely occurred. From an infection prevention standpoint, it was definitely a challenge. I have to say that with the Northwell Health leadership, there was collaboration as far as making decisions on how to keep our patients safe, how to manage patients, and also how to keep our healthcare workers safe. It was very important to make sure that we had the appropriate personal protective equipment so they can come to work every day and take care of, the patients that really needed their care. Hospitals did get overwhelmed. We managed the challenge. We were able to care for all the patients. And we did have some remarkable outcomes. Patients were discharged. And today, things are looking better. It's looking brighter. People are more positive. We have less cases coming to the hospitals, which actually relieves some of the burden to our healthcare workers. We're seeing the decrease in the community. From a benefit standpoint, less cases, to me, is kind of more freedom. We do have to adhere to the current infection prevention practices. They've worked to date. We should continue with that at some point in time. We may be able to get back to what we consider, what was normal, meaning without masks, touching people, being shoulder to shoulder. But we still need to keep the practices and promote vaccination at this point.
I know you've done a tremendous amount of work behind the scenes, and I just want to publicly thank you and your colleagues for the work that people don't see that goes on in our hospitals every day. A big shout out to you and your colleagues in the infection prevention world who have been really shouldering an enormous burden this entire year.
I appreciate the recognition, and I think that's why we all went into healthcare.
Yeah, so let's talk about the subject at hand, so to speak, which is about antibiotics and resistance to antibiotics. So let's start with some very basic stuff. What are antibiotics, and how do they do their work?
Starting with the basics, antibiotics basically are, medication that generally someone would take if they have an infection. And the antibiotic does target the bacteria, and it decreases proliferation and growth, and basically blocks certain mechanisms of the organism so it doesn't continue to grow.
So just to be clear here, so antibiotics target just bacteria, not all kinds of infections, right? So people get infected with other things, but when we use the term antibiotics, we're talking about antibacterial drugs, right?
That is correct. We're talking about targeting bacteria. We're not looking at antibiotics because they do not target and they do not treat viral infections. So just, for some example, if you have a bacterial infection such as strep throat, it'll be appropriate to take an antibiotic, or whooping cough, or a urinary tract infection, or if you're hospitalized and, you're diagnosed with sepsis and you have a positive blood culture, those appropriate situations where you should receive antibiotics. If you have the common cold, a runny nose, maybe a sore throat, even if you have influenza or, bronchitis, this is not the situations where you should, take an antibiotic. You may be prescribed it, but you should not be taking antibiotics for viral infections.
We'll get to prescribing habits in a minute because I think that's an important part of this. But I think that's the key distinction that I wanted you to get out there, that we're talking about drugs that are useful only against bacteria and not the full range of other things that cause infection. So what is antibiotic resistance and how does that happen?
Individuals basically have bacteria that's part of their normal flora. Once you take an antibiotic and the bacteria is exposed to this antibiotic, at times some of the bacteria will be altered or it'll mutate because of the exposure to the antibiotic. It becomes resistant. And once it becomes resistant, that antibiotic that you were initially prescribed basically won't work anymore. And that's part of the issue with antimicrobial resistance. It basically fails to treat, the infection with standard, treatments, and you basically have to take more powerful antibiotics, to treat the infection you have. I mean, most of us have heard about some of the resistant organisms, that are common. We've all heard about methicillin-resistant Staph aureus. It's also referred to as MRSA. There's also drug resistance with tuberculosis, but thank goodness tuberculosis has decreased compared to the past. And there's other foodborne illnesses such as Campylobacter, Salmonella, that also have developed resistance. And you're starting to hear more and more about Candida auris. It's a yeast. It's fairly resistant to standard antibiotics. And it's hard to treat. And we are starting to see more and more of these cases present with utilization of antibiotics.
And so this is a problem not just for the person who got treated with the initial round of antibiotics, but it allows these bugs to then spread to other individuals who may also find that the standard drugs don't work for them as well. Is that right?
Yes, so that's correct. So an individual that has a resistant organism, generally they can transmit that resistant organism to another individual, especially if they're immunocompromised, which means they have a weakened immune system. They get exposed to, the resistant organism. It becomes part of their normal flora. And at times it'll progress to infection, and now this individual gets infected with a resistant organism. So there is a concern of individuals developing the resistance, and then thereafter it being transmitted to somebody else via direct contact or possibly indirect contact, which could be contaminated surface, a contaminated piece of equipment that an individual has contact with.
Yeah, so it sounds like we're in kind of an arms race with bacteria, right? So they get resistant. We use a more powerful antibiotic. They get more resistant to that. We use a more powerful antibiotic. Is that a useful way to think about this?
I would say the answer is yes. It is basically a vicious cycle at the present time. The focus is really to prevent infections, which then decreases the use of antibiotics, therefore decreasing resistance. But that's a change that has to come both from a patient perspective as well as, the prescriber. So you want to ask the question, how does it happen? It basically happens initially through overprescribing and misuse of antibiotics. And I'm going to make this sound simple, but it's not. Basically, the prescriber is giving the wrong antibiotic. Sometimes people get antibiotics and they don't need it to begin with. It's the wrong dose, and then the duration. Sometimes it's too long. And then from a patient perspective, you want the antibiotic, so the doctor gives it to you even though you don't need it. Once you have the antibiotic, you start to feel better, so you don't complete the dose. Occasionally you do hear, well, I'm sick, and then we share antibiotics, so you're taking somebody's leftover medication. This all contributes to antimicrobial resistance. And I know we're talking about antimicrobial resistance, but people also need to realize that antibiotics themselves have side effects. It's not like, you could take them and there's no, negative consequences. Some people get a rash, you feel nauseous, you increase yeast infections, and then there's also, GI symptoms that occur, and you can get diarrhea, and there's antimicrobial-induced diarrhea called Clostridioides difficile, also referred to as C. difficile. And this is not benign either. I mean, people get severe colon damage, could lead to death, and I'm just going to quote some estimates from the CDC, where each year about 250,000 people are hospitalized due to C. diff that's related to the antibiotics, and there's also 14,000 deaths. And then the last thing I'm going to mention is that there are severe allergic reactions, and some of them could be life-threatening. So antibiotics are good when they're prescribed correctly at the right dose for the right duration, because it will kill the bacteria, but there are side effects that we also have to be concerned about.
Yeah, well, so you've laid out a lot of reasons why people should not take antibiotics kind of willy-nilly, or that doctors should not be too quick to prescribe them. But I just want to clarify one thing that you said. Isn't it true that even if we used antibiotics perfectly appropriately, meaning just for the people who need them and at the right dose for the right duration, wouldn't we still be facing the emergence of some resistant organisms?
Probably yes, but not at the levels of resistance that we're currently seeing today.
Okay. It's kind of a problem of our own creation in a way, that doctors and patients see antibiotics as these miracle drugs, which they really are, and their overuse and misuse has led to this new problem that ironically has made the drugs themselves less useful.
Right. And the other part that you have to be concerned with is, the more and more resistance that presents, what antibiotic are we going to use? At some point in time when it's completely resistant, there is no antibiotic to be given. So what do you treat with? So, we're trying to avoid getting to, complete pan-resistance of organisms. And I think there is an opportunity to, minimize the ongoing development with resistance by changing our prescribing habits and also patients' expectations. So we could try to decrease antimicrobial resistance and not get to the point where we have certain organisms that are completely resistant, to every antibiotic, and there's no last resort. What else are you going to give?
Yeah, so I do want to talk about what that might look like. But before we get there, you mentioned something before that I want you to elaborate on a little bit, which is the importance of preventing infections in the first place so that people don't need to get antibiotics and we don't start this whole cascade of bad outcomes that we've been discussing. So is that something that is particular to the hospital setting, or are you saying in general there are things that people can do to reduce the risk of getting a bacterial infection?
I see you mentioned, hospitals. Hospitals and the infection prevention programs there are very unique. But there are prevention measures that people in the community can follow, and I'm just going to give one example of mask wearing, over this past flu season. Individuals wore masks. We did social distancing. We basically had a flu season that was non-existent. We saw very few cases. And that was just everyone practicing infection prevention measures to minimize the transmission of a particular virus, which resulted in less cases. So same principle could be applied to everyday life. Keeping healthy, we shouldn't take that lightly. If you keep your immune system up, you have the ability to fight infections. Regular health visits is a good way to maintain your health. Maintaining up-to-date vaccinations is another way. You'll prevent illness or decrease severity of an illness if you get vaccinated. And then it's the basics. And, I'm infection prevention, and you probably, know infection preventions, push the hand hygiene. It is a good way to minimize transmission from contaminated surfaces to yourself as well as to others. Covering your cough. If you're sick, stay home. Why are you going out to the store? Why are you going to work? All you're doing is exposing other individuals to what you have, and there is a possibility that there could be, transmission. Basic principle is basically kind of keep it clean. Wipe surfaces, clean your hands.
So those are great pieces of advice around your own home, and I especially liked what you said about maintaining your general health as an infection prevention measure. I think that's a really good piece of advice. Talk to us a little bit about what's done in hospitals to prevent the spread of infections, because I think a lot of our listeners are probably associating bad infections with things that you might actually catch in a hospital or land in a hospital if you get someplace else.
Yeah, so that brings up a good point. In a hospital, the first rule really is recognizing individuals who are potentially infectious and keeping them segregated. We use the term, precautions, isolation, and basically that is a way to minimize exposure to an individual that has an infectious disease or some type of resistant organism that could be transmitted from person to person. So we do keep them separate. And then we go back to the basics again. You dedicate the equipment to the patients, nurses, physicians, other healthcare professionals that go in. We provide them with personal protective equipment to protect their clothes. They wear gloves. If there's transmission through the air and it's really small particles, we have them wear respirators. If it's more a larger particle, then it's just a mask. So there are ways that we manage these patients in the hospitals to decrease the transmission to other patients as well as healthcare workers. And then the other component is you have patients that come in that are healthy, and because of some of the manipulation or some of the devices that get placed into patient, we actually break their skin barrier, and we could potentially introduce organisms into the patient. So we do standardize procedures such as putting in a device directly into a vein, to deliver fluids. So we minimize the introduction of bacteria into the patient's bloodstream and then preventing an infection. And we also do this with surgery. There's standard protocols that people follow, with skin prep, with the sterilized instruments, preoperative antibiotics, that are just part of what is done every day for every patient, so we could minimize infections. I've been doing infection prevention for a number of years, and I have to say observing infection prevention measures to decrease infections have definitely become a part of a hospital's everyday functioning today compared to maybe 10, 15 years ago. So I'd like to feel I contribute to some of that, of what's happened in healthcare, but the hospitals have definitely bought into prevention, keeping patients safe, and not giving them something that they didn't have before they came into the hospital.
What are some of the newer techniques that hospitals are using to clean surfaces or prevent the spread of bacteria in the hospital setting, besides the old-fashioned, just kind of clean it down with antiseptic solution? What else is going on in hospitals these days?
So there's definitely been some enhancements in environmental cleaning. You mentioned, the routine disinfection with impregnated wipes. I mean, that's still a primary way of cleaning and disinfecting. But we have introduced ultraviolet light. There's also hydrogen peroxide that's been introduced to hospitals. Some institutions have brought in air devices that basically remove particles from the air. So there has been, some changes in how we clean the environment. But truthfully, primarily right now, it's still the old-fashioned way, with mops and disinfectant cloths.
Yeah, so that doesn't sound like it's changed much in a generation. Maybe the stuff on the mop is different.
The stuff on the mop is different, and once again, you're using the right disinfectant at the right dilution within the appropriate period of time, so it actually does have disinfection properties.
Yeah. So, I want to get back to something that you mentioned before, which is this sort of nightmare scenario where we kind of run out of effective antibiotics. Is that a real risk?
Yeah, I would say it's a real risk. I mean, we have occasionally, not often, but occasionally have seen certain bacteria or organisms that are completely resistant. You know, and infectious disease physicians find this a challenge as far as, you know, what they can prescribe to potentially, you know, minimize a spread of the bacteria. But our antimicrobial programs that we're currently putting in place and have in place both in the ambulatory setting and the hospital setting is an effort to prevent this from, you know, continuing at this point and at least leaving our bacteria susceptible.
Right, but I think it's probably worth painting a little bit of a picture of what that might look like if we do end up with a situation where a kind of bacteria or a class of bacteria becomes completely resistant to all the drugs we have. That's sort of like taking us back to the era before we had antibiotics, right?
The answer to that is probably yes, but I don't want to look on the negative side. I really want to focus on, you know, really just trying, you know, to prevent this from happening and basically, you know, work with, and it's not just physicians, it's not just, you know, prescribers, it's also pharmacists, it's the nurse. I mean, we all take part of, you know, helping with the diagnosis, you know, questioning drug selection or optimization. You know, when a patient comes in and you don't know what their you know, the type of infection they have, once you get the laboratory results, maybe with positive, you know, cultures and specimens, you know, you look at the antibiotics and you de-escalate and you put them on the right antibiotic, you know, for the right period of time. It's still getting back to, you know, constant evaluation and making sure that we prescribe the right drugs, you know, for the right patients and only give it when it's really needed. And we do have these programs in the hospital.
Yeah, so it sounds like it's really about tailoring the treatment to the circumstances. But to what extent is the use of antibiotics outside of the medical setting driving the whole problem of antibiotic resistance? I'm thinking specifically of the use of antibiotics in agriculture, you know, and treating livestock. Talk to us a little bit about that.
Livestock, poultry, you know, they're exposed to antibiotics either directly or through their feed, and they do develop antimicrobial resistance. And, you know, you having contact with, you know, raw chicken or surfaces that are maybe contaminated with poultry in the presence of resistant organisms, you have contact with it. There is a possibility transmission, you know, could occur. There are ways of, you know, minimizing spread, you know, from contaminated surfaces or from, you know, meats that are contaminated. You know, it's the thorough cooking. It is decontamination of, you know, surfaces that maybe you prepared meats on. You know, some individuals use separate cutting boards for meat and for lettuce. You also have to be worried about, you know, fruits and vegetables also that have potentially been contaminated through animal waste as well as water that may be contaminated. You know, ways to, you know, minimize contamination there is, you know, just rinsing, you know, fresh, you know, fruits and vegetables, you know, just to minimize exposure through poultry, your meat supply, and your fruits and vegetables.
Do you think the use of antibiotics in the beef, poultry industry or in livestock in general, do you think that's a threat to human health? Should we just not be giving chickens antibiotics or not giving pigs antibiotics?
Well, I'm not going to make too many comments on that, but I know the U.S. Food and Drug Administration as well as the Department of Agriculture are also working with veterinary medicine and agriculture to improve antimicrobial utilization. It's probably no different than human drug utilization. Overuse, misuse has led to the same resistance in animals as, you know, there is in humans at this point.
Yeah, so it goes back to the same sort of good prescribing habits, right? That works for animals as well as humans. It sounds like your role as an infection preventionist goes well beyond some of the issues we've been talking about in terms of antibiotic resistance. Just curious, what got you interested in the field in the first place?
So I started in healthcare, a number of years ago, and I worked as a float nurse, and had exposure to multiple areas. I was able to have experience with newborns as well as those coming to the emergency department. I had an interest of continuous learning, and the infection prevention job opened up. I sat down with the individual that was overseeing the program. I thought it was interesting. I knew it was not a mundane job. I actually interviewed with the head of infectious disease, who I currently still work with. He started a week before the interview. We have continuously worked together. If I go through my past history, I've done a number of outbreaks. There was measles outbreaks, actually the H1N1 infection that was identified here on Long Island. It was one of the hospitals within the health system. Happened on a Saturday, came in, and I think the rest of it is, history. There's been, quite a bit that has occurred in my career, including anthrax, which was very interesting with the powder and the letters. And people showing up to the emergency department thinking that they had anthrax because, the powder on the donuts that fell off the envelope, is causing them to get the infection. So it's been an interesting career, not quite over yet. And this pandemic is definitely one for the books.
Yeah, well, in so many ways. We've been talking about infection prevention. We've been talking about antibiotic resistance. Where can our listeners go to get more information about these subjects?
A primary resource that I usually go to is the Center for Disease Control and Prevention. And you could look up any infectious disease, including antimicrobial resistance, and that's at https://www.cdc.gov/drug-resistance/index.html. A lot of information could be looked at that particular site.
Great. Any other authoritative sources besides the CDC, or do you think they're really the place to go?
I would go there first. You could also look up the various studies that are out on antimicrobial resistance, as well as programs that have been put in place and actually have had pretty good success. It is a program that once you put in place, it has to be kept up with.
Yeah. Well, look, I want to thank you again for the work that I know you've done, tremendous amount of work behind the scenes that has saved countless lives, honestly, and the work that you continue to do to help the health system, Northwell, cope with the COVID pandemic, and for joining me today on Well Said.
Appreciate the invite, and I do want to thank the leadership as well as the colleagues that I work with. It's not a one-person show, it's really just a team approach.
All right. Well, for more information about this program and to find past episodes, please visit sites.hofstra.edu/wellsaid. You can also subscribe to our free podcast available on Apple Podcasts, Stitcher, or wherever you get your podcasts. Our listeners are welcome to send comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.